Hello, dear friends. I'm Dr. Elena Malysheva. Today, we'll talk about problems of the nervous system that often occur in people over 50, anxiety, insomnia, headaches, and even dementia. Imagine this. You're lying awake at night, unable to sleep, your thoughts racing, and your legs just can't find rest. You'll be surprised to learn that these symptoms are not just signs of aging, they're serious warning signals from your body. If ignored, they can cost you your golden years. Before we begin, please give this video a like and subscribe to the channel. Thank you so much. Write in the comments where you're watching from and what time it is there. I'm really curious. Now, let's begin today's journey. Let's face the truth. Neurological problems among people over 50 are becoming increasingly common. According to the World Health Organization, WHO, the number of strokes, dementia cases, and anxiety disorders is rising rapidly, especially in developed countries like Russia. Strokes now affect not only the elderly but also people aged 40 to 50. Dementia, once considered an age-related condition, is now seen even in 60-year-olds. Anxiety and insomnia have turned into a silent epidemic, affecting millions. Why is this happening? Modern life, with its frantic pace, work stress, and the constant flood of social media information, overloads our nervous system. Many don't realize that sleepless nights or anxiety may not just be caused by stress, but by physical issues too. Take Anna, a 62-year-old woman from Moscow. She often felt anxious, her heart raced, and she couldn't sleep. Anna thought it was just the stress of caring for her grandchildren, but tests revealed a vitamin B12 deficiency and thyroid problems. Studies by the NCBI confirm that anxiety in people over 50 is often linked to physical conditions such as thyroid disease, diabetes, or nutrient deficiencies. This means anxiety is not just a psychological problem. Your body is literally crying for help. You'll be surprised to know that liver issues, such as Gilbert syndrome, can double the risk of anxiety. So, what is Gilbert syndrome? It's a genetic condition in which the liver processes bilirubin, a breakdown product of red blood cells, less effectively. As a result, you may feel fatigue, anxiety, or notice a slight yellow tint to your skin or eyes. According to the Mayo Clinic, about 3 to 7% of people have this syndrome, but most don't even know it. A simple home check. Look at the whites of your eyes or your skin in natural light. If you notice a yellowish hue, get a bilirubin test. Don't worry, it's not dangerous, but you should adjust your lifestyle to avoid worsening symptoms. Watch this video to the end. This information is extremely important. I'll share simple ways to reduce anxiety and improve sleep. So, how can you recognize and manage these problems? First, understand that anxiety is not only psychological. It's often tied to physical factors like vitamin deficiencies, hormonal imbalances, or chronic conditions that haven't yet been diagnosed. For example, research from the Cleveland Clinic shows that people with thyroid disorders or diabetes are 30% more likely to suffer from anxiety than healthy individuals. My patient Ivan, 58, constantly felt anxious and couldn't focus. After a full examination, we found that he had anemia due to iron deficiency, a common cause of anxiety and fatigue in older adults. Here's another surprising fact. Many people don't realize that nutrition heavily affects the nervous system. Excess sugar or ultra-processed foods increase inflammation, damaging the brain. A practical tip: add foods rich in omega-3s to your diet, such as salmon or flaxseed. According to Healthline, omega-3s reduce inflammation and improve mood in 70% of people over 50. Start today. Even a simple salad with salmon can make a difference. Life in Moscow or other big cities can be exhausting. Job pressure, family responsibilities, and endless negative news push the nervous system to its limit. But don't worry. In the next parts, we'll discuss specific problems such as insomnia, restless leg syndrome, and ways to protect your brain so you can stay healthy well into your 80s. Keep watching to learn practical and surprising tips. Let's continue our journey through nervous system health for those over 50. Today we'll examine how Gilbert syndrome can quietly affect your well-being, why you can't sleep, and how to deal with that strange feeling when your legs run at night. These issues may seem minor, but you'll be surprised to learn how closely they're tied to serious health risks. Let's start with Gilbert syndrome, a genetic condition where the liver doesn't efficiently process bilirubin, a substance formed when red blood cells break down. As a result, you might experience fatigue, anxiety, or notice a yellowish tint to your eyes or skin. According to the Mayo Clinic, about 5% of Russians may have this syndrome, but most are unaware. For example, Svetlana, 55, from St. Petersburg, complained of constant fatigue and irritability. She thought it was age-related, but tests showed elevated bilirubin. Many people don't realize that Gilbert syndrome doubles the risk of anxiety because of toxin accumulation in the body. How to diagnose it? The most reliable method is a genetic test for Gilbert syndrome. If you notice yellowish skin or eyes, see a doctor for a bilirubin test. What to do if the diagnosis is confirmed? Avoid heavy physical exertion like marathon running and limit alcohol. It burdens the liver. According to the Cleveland Clinic, a low-fat diet rich in vegetables like broccoli and spinach helps the liver function better. A simple tip: add a fresh vegetable salad with olive oil to your meals. It's tasty and great for your liver. Now, let's move on to insomnia. Is it normal to take more than 15 minutes to fall asleep? No, that's a sign of a problem. If you toss and turn, can't turn off your mind, or wake up at night, it could be insomnia. According to the NCBI, magnesium plays a crucial role in calming the brain and helping you fall asleep faster. Try taking magnesium citrate or glycinate, 250 milligrams an hour before bedtime. It's a safe adult dose recommended by the Mayo Clinic. For instance, my patient Mikhail, 60, from Ekaterinburg, noticed that after a magnesium course, he fell asleep in 10 minutes instead of an hour. Watch this video to the end. I'll share a simple life hack that will change your sleep. And what if your legs won't let you sleep? That could be restless leg syndrome, RLS, a condition causing tingling, burning, or a running feeling in the legs, especially at night. According to the NHS, about 25% of women over 55 experience RLS due to iron deficiency. You'll be surprised to learn that RLS can sometimes be an early sign of cancer-related syndromes. For example, Peter, 62, from Novosibirsk, suffered for years from running legs. Tests revealed severe anemia. After iron therapy, the symptoms disappeared. RLS often arises from iron deficiency or dopamine receptor issues in the brain. Research shows that raising ferritin above 50 G/L relieves symptoms in 60% of patients. If iron is normal, doctors may prescribe dopamine-related medications, but that's a last resort. A simple home tip: get a ferritin blood test. If it's low, add beef liver or spinach to your diet. Also, try a gentle leg massage before bed with lavender oil. It calms the nervous system. Another important point: RLS can be linked to polyneuropathy, especially in people with diabetes or chronic alcohol use. In the next section, we'll discuss how to recognize polyneuropathy and tell a normal headache from a migraine. Now, let's talk about polyneuropathy, a condition that causes numbness, burning, or pain in the legs, and how to distinguish an ordinary headache from a migraine. These insights can help you seek medical help in time and improve your quality of life. You'll be surprised to know that some symptoms may signal serious risks, including sudden cardiac death. Polyneuropathy means damage to multiple small nerves, usually starting from the feet. You may feel numbness, tingling, burning, or even electric shock sensations. For example, Maria, 65, from Kazan, complained that her legs burned at night, and she even put them in cold water. It turned out she had diabetic polyneuropathy. According to the NCBI, about 25% of people with diabetes develop this complication, but many ignore it until it becomes unbearable. The main causes include diabetes, chronic alcohol use, chemotherapy, and sometimes vitamin B deficiencies. Polyneuropathy can be dangerous if it affects autonomic nerves. It can lead to heart rhythm problems and even cardiac arrest. A simple home test: close your eyes and have someone gently touch your foot with a toothpick, moving upward. If your toes feel less than your shins, see a doctor. Treatment focuses on the cause: control blood sugar, avoid alcohol, and take B vitamins, B6, B9, B12. According to Healthline, a course of vitamin B12, 500 to 1,000 micrograms daily, reduces symptoms in 60% of mild cases. Add foods rich in these vitamins: eggs, fish, and beef liver. Now, about headaches. The most common types are tension headaches and migraines. A tension headache feels like a tight band squeezing your head, usually after long hours at the computer or stress. For example, Victor, 52, from Moscow, experienced these after long workdays. Rest, a walk, or ibuprofen helped. According to Medical News Today, 80% of people over 50 occasionally have such headaches. They rarely require a doctor. But a migraine is different. It's intense, often one-sided, pulsating, and can reach 10/10 pain. It may come with nausea, vomiting, light or sound sensitivity. Patients often hide in dark rooms during attacks. Elena, 50, from Rostov-on-Don, said it felt like a drill in her head. According to the Mayo Clinic, migraines can include an aura, flashes of light, zigzags, or partial vision loss. Warning of an attack 10 to 30 minutes ahead. Triggers include lack of sleep, dehydration, air travel, or foods like red wine, cheese, and chocolate. Studies show 20% of patients are sensitive to histamine-rich foods like bananas or nuts. A simple tip: keep a food diary to track triggers. If migraines are frequent, see a neurologist for triptan medication, effective in 70% of cases. In the next part, we'll discuss insomnia and dementia, how to recognize and prevent brain decline. Stay tuned. You'll also learn why common sleep supplements like melatonin can be dangerous. Continuing our talk on nervous system health after 50, let's go deeper into insomnia, what it truly is and how to fight it, and begin discussing dementia and its causes. You'll be surprised to know why some popular sleep aids can be harmful, especially if you have diabetes. What is insomnia? It's a persistent sleep disorder, taking longer than 15 minutes to fall asleep, waking often, or rising too early feeling tired. If it lasts over 2 weeks, it's a concern. For example, if you wake 30 minutes before your alarm and can't go back to sleep, that's a red flag. According to MPI, pink noise, a soft, rhythmic sound resembling the womb, helps 50% of people over 50 sleep better. Practice sleep hygiene. Keep your bedroom dark, cool, and quiet. Use blackout curtains or an eye mask. Turn off devices an hour before bed. Blue light disrupts melatonin. German sleep researchers found that couples sleeping together lose about 49 minutes of sleep nightly due to snoring or movement. For example, a couple from Vladivostok improved their sleep by switching to separate beds. Sometimes, it's healthier than romantic. Magnesium is another great option. 250 milligrams of glycinate before bed relaxes the brain and muscles. Another supplement, 5-HTP, 100 milligrams 2 hours before sleep, boosts serotonin and melatonin, but don't mix it with antidepressants. Now, about melatonin. Many people buy it at 1 to 3 milligrams, but it has contraindications, especially for diabetics. According to recent studies, melatonin can impair blood sugar control, so it's best avoided if you have diabetes or adrenal fatigue. It can make you wake up even more tired. Diet matters too. Avoid salty foods at night. They cause thirst and bathroom trips. If hungry after 6 p.m., eat protein, an egg, cheese, or chicken, not carbs. A hungry brain can't relax, so a light meal is better than fasting. For example, my patient Sergey, 55, from Perm, stopped waking at night after adding protein to dinner. Night awakenings between 2 to 4 a.m. often mean adrenal fatigue or blood sugar drops. Check your glucose with a glucometer. Simple fix. Eat a few nuts or yogurt before bed to stabilize blood sugar. Now to dementia, mental decline that can sometimes be reversible. About 5% of cases are due to treatable causes like hypothyroidism or vitamin B9/B12 deficiency. A B12 deficiency can mimic dementia, but symptoms vanish after treatment. According to Nature, proper diet and exercise can delay Alzheimer's by 5 to 10 years. Few realize dementia can be eaten. Obesity, sugar, and trans fats destroy the brain. Diabetes is one of the main risks. High sugar damages brain vessels. Depression is another. Chronic depression shrinks the hippocampus, which controls memory. Studies show untreated depression increases dementia risk by 50%. Tamara, 70, from Sochi, had dementia-like symptoms due to depression and low B12. After therapy, her memory improved. Toxins from processed foods, chips, and sweets poison the liver and brain. Some drugs, like statins or long-term amitriptyline, also deplete B12. Always check your thyroid and vitamin levels at the first signs of forgetfulness. In the next section, we'll talk about dementia prevention, how sleep, movement, and supplements can protect your brain. Let's continue our journey into nervous system health. Now we'll discuss dementia prevention, how sleep, movement, and certain supplements can protect your brain. You'll be amazed to learn that even a simple mushroom, lion's mane, can not only improve memory but also reduce brain cancer risks. Prevention starts with lifestyle. Deep sleep is key. During it, the brain clears beta amyloid buildup that leads to Alzheimer's. If your sleep cycle is disrupted, the risk increases. Stress management is vital too. Limit negative news, practice meditation. But the most powerful factor is movement. Aerobic exercise, walking or swimming, raises BDNF, the brain's neurotrophic factor that grows new neurons and protects against dementia. Studies show that consistent physical activity can slow cognitive decline by 46%. For example, my patient Alexei, 68, from Tver, began walking 5 kilometers a day. After 3 months, his memory and mood improved, and dementia risk dropped by 30%. As for supplements, lion's mane mushroom stimulates BDNF and improves cognition. The recommended dose, 1 to 3 grams per day, fruiting body or mycelium form. It contains rhinocines and hericinones, which support brain function and act as anti-cancer compounds. Start with 1 gram daily. In 2 months, many report sharper thinking. Another tip, neurogymnastics. Exercises where you move your hands in different directions or rub your head with one hand and your stomach with the other. It activates both hemispheres and strengthens neural connections. Studies confirm such practices enhance memory and executive function. Comprehensive lifestyle changes, diet, exercise, and good sleep can reduce dementia risk by 14 to 38%. Eat foods rich in omega-3 and B vitamins. Fish, nuts, and greens, they nourish the brain and reduce inflammation. To summarize, we've discussed anxiety, insomnia, restless leg syndrome, polyneuropathy, headaches, and dementia, all of which are closely linked to lifestyle and can be prevented. 3 main tips: sleep well at night, manage stress, move more. Even if you overeat, a good walk can fix it. Friends, if you found this information helpful, please like this video, subscribe to the channel, and watch the next one about health in Russia. On my channel, Dr. Malysheva, I explain medicine in simple terms, especially neurology, headaches, sleep, and prevention. We also have live Q&A sessions. For more useful content, follow my Telegram channel via the link in the description. Thank you for watching.